This module is going over the evolution of EMS, how it got here, where we're headed from here. So EMS is really an interesting kind of mix-up of several different areas. We include both a little bit of public safety, a little bit of public health, and some healthcare as well. So we're really kind of at a crossroads between several different areas. So really what brought about what we consider modern EMS is going to be the white papers, The Accidental Death and Disability and Neglected Disease of Modern Society, that was published in 1966 by the Department of Transportation. And what this paper did was really just shine a light on accidental deaths and that something needs to be done about it. For early EMS, it really started with horse-drawn ambulances, carriages essentially. I believe the first use was 1869. And they would pick you up and take you to where you needed to go. Later on after that, you had hearses that were actually used as ambulances. Kind of interesting. If you were alive when they got to you, they took you to the hospital. If you were dead when they got to you, they took you back to their morgue, to their facility. Some of the first rescue squads began on the East Coast in the 1920s, and of course have evolved since then. But after the white papers were published, really EMS started really taking off rapidly and began growing and developing exponentially. A lot of our care, especially in the trauma area, does draw upon military experience. Copter transports started in the Korean War and Vietnam War and carried over into civilian life when they were able to see that a lot more soldiers were able to survive with the medevac versus how many people we had dying here just from traffic accidents. Other things that we've gotten from the military, things like tourniquet use and other treatment modalities. Some key dates in EMS history, there's a lot of them. But 1950s, the American College of Surgeons developed their first training program for your ambulance attendants. In 1966, the white paper was published, and like I said, that kind of quantified how bad the traffic-related deaths were, and it called for ambulance standards and policies and regulations in order to provide consistent services across the board. Your next thing, the same year, the Highway Safety Act of 1966, and what this did was says each state has to adopt a highway safety program to comply with your federal standards. This also, within this, directed NHTSA leadership to write the national standard curriculum and provided funding to the states to develop state EMS offices. The next one, 1970, the National Registry of EMTs held their first board meeting, and the goal there was to create your uniform standards for people who were on the ambulance, for credentialing for the EMS people. In 1975, the American Medical Association recognized EMT paramedic as an allied healthcare profession or occupation. In 1977, the National Standard Curriculum for EMT was actually published. So it's kind of interesting. From 1966, when they directed it to be published, it took 11 years to actually be developed and published in 1977. There were a few things in late 70s, early 80s, and early 90s, where they did some revisions. But the next big thing is 1986, the EMS Agenda for the Future was published. And what this does, gave a vision statement for integration of EMS into the healthcare system and said that we need to bring it more into healthcare, less on the Highway and Traffic Safety Association. In 2000, the Educational Agenda for the Future, a Systems Approach, was published, and what this does was it was designed to kind of integrate your regulation, certification, and licensure all into one area. In 2005, you had your National EMS Core Content published, and what this was kind of defined the knowledge that each EMS personnel should have and what universal skills and knowledge they needed to possess. And then in 2007, you had the National EMS Scope of Practice, and this defined your levels of EMS care and licensure to help guide your state legislation and rulemaking, to help provide and promote your reciprocity between your different states so that you can work in multiple states, and to clarify EMS roles for the community as a whole.